What we call the PICU, the Pediatric Intensive Care Unit, is a place where the very sickest of children, from tiny infants to young adults really, can receive optimum care to get them through critical, even life-threatening illnesses. Every day, the Pediatric Intensive Care Units in both hospitals will see coming through the unit cardiologists, pediatric surgeons, neurosurgeons, neurologists, infectious disease experts, pulmonologists, and of course anesthesiologists, all helping out with the complicated, difficult care of these very sick infants and children.
Most of the patients that come to our ICU are admitted through the emergency room. About 60% of our patients come through the emergency room. The other 30 to 40% are a combination of surgical admissions or direct referrals from the outside.
The PICU, the Pediatric Intensive Care Unit, also does ECMO. That's a specialized program where we can provide oxygenation for a child whose lungs need to rest for a while. Very few hospitals do ECMO, and we have a nationally renowned program for that.
Our new environment finally begins to match the level of wonderful pediatric intensive care that we've been giving for so long. We've moved out of units that were outdated, too small, difficult to work in, to units that I consider to be the most beautiful, most family-friendly that I've ever seen in a children's hospital.
One of the important pieces of new technology that we do have in the PICU is called eyewear. And it's similar to a monitor, but it's a different type of monitoring, and it shows us a trending of the patient's data. Nurses in the PICU care for usually 1 or 2 patients at a time, sometimes up to 3 when they're at a more intermediate status. And it's nice to sometimes get out of the room so you can give the parents some private time with their child too, but you don't want to do that without losing sight of the child. So with the monitors and the computers outside the room, you're able to do that.
This is my daughter Beatrice. She came in because they suspected she was having seizures that were not benign, that she was previously diagnosed with, and breathing issues. When we actually got transferred up from the ER, they let me carry her, which was great. And then the doctor met us at the door with 3 nurses. And they explain everything, and if you have a question and they don't know, they find out and they come right back and tell you. And it was phenomenal. I mean, it's a wonderful hospital. Yeah, it's amazing.
I think there are several things that make the children's PICUs different from most. One is the presence of an intensive care specialist, fully trained, present 24 hours a day in either campus. The other is the intense focus on the family as the unit that we're taking care of. For example, in our rooms, each private room, and all of them are private, has a bed for a family member to stay. That family member has a private bathroom, has a telephone, has high-speed internet connection. We, more than any place that I've been, and I've been to several, are committed to keeping the parents and the family as part of the team taking care of the children. We would not be able to provide the kind of care and the kind of caring that children need without families like the POLADs, without foundations, without individual donors.
I think the care that we provide for the children is the best, and I think we support the whole family, and I think we have the environment, we have the resources, and the team that knows how to care for kids.
I'm going to be posting on Facebook, you gotta go, if you have to go to Children's. So it's been great. I mean, for a hospital experience, it's really been phenomenal. Everybody's been so nice.